So thank you all for joining us today. It's just incredible. I'm seeing, close to 90 people on this call today, which just tells us a little bit about the interest in nutrition. What we're going to do today is share with you some early interpretations of trends in nutrition outcomes, determinants, and interventions. This is a rapid analysis of the data that's captured in the NFH5 state fact sheet. As I mentioned earlier, I'm Purnima Menon, and I'll be presenting the work to you today. And I'll share with you a bit the names of all the other contributors. It's a team effort, and the slide deck itself is an evolving work in progress. We are making updates and inputs to this daily. So if you want to use or cite or do anything with this, please email us to receive the most updated copy of it. We will put one version of this up online on SlideShare so that it will go out with the UNICEF POSHAN Weekly mailing tomorrow, but it is totally being continually updated. So, if you see, you need to pay attention to the date there, and if you're more than 5 days after that date, there would likely be a new version to look at because the work is evolving. So here are the contributors that have worked on this with us. A core team at IFPRI supporting and organizing the analysis. Anjali, Pant, Isha, Manita Jangi, Shmeet Singh, Peng Nguyen, Purnima Menon, Rasmi Avula. In the 2 days since we presented the first round of this, we have had additional contributions come into the economic and social protection analysis that you will see from Avinash Kishore and Manvi Gupta, in particular at IFPRI on data. As well as some insights on the social protection programs from Sudha Narayan and Kalyani Raghunathan, all of them at IFPRI. And then some data on NREGA in particular from Avni Kapoor and Ritvik Shukla at Accountability Initiatives. The reflections meeting on Tuesday had 50 participants, and we'll put the number of participants from today's meeting in here. We will put all of your names of everybody who attended these 2 meetings at the end of the slide deck, so that you are all captured in it as well, because we think this is going to be a collective interpretation effort in the end. All right, so our agenda today is to share preliminary findings. I will do my best to stick to about 30 minutes. It would be great to get a signal in the chat box from somebody on my team if I'm getting too far beyond that, or maybe 5 minutes before. What we really want is inputs from everybody here on, what do you think are some of the further analyses that are needed? Where should we dig more? And then, also any insights that you have on interpretation. We would encourage you to please use the chat box because we'll save everything that anybody puts into the chat box. So, feel free to collectively owned set of research questions that maybe a partnership of researchers could engage in and work on together. Last but not least, sorry, I just need to check with the team. The meeting is being recorded, right?
Yes, Purnima.
Okay, thank you so much. All right. Okay, great. Okay, so let's move on. What did we aim to do since the fact sheets were released on Saturday night? We wanted to do an initial assessment of state level trends between 2016 and 2019. We used the data from the NFHS5 state fact sheet, which were downloaded and converted into both Excel and Stata to enable data visualization and trend analyses. We've looked at trends between NFHS5 and 4 for select nutrition outcomes, determinants, and coverage. We've analyzed it based on what is a broader comprehensive set of indicators for POSHAN Abhiyaan itself. We've done a focused analysis of Bihar because it is a state where we've seen substantial improvements in stunting. And then we're working on developing a policy timeline, so sort of a policy and economy timeline to support interpretation. There are lots of caveats, lots of limitations to this work, as you might imagine, because the NFHS4 data, one of them, for example, is we've only used the data from the fact sheets, of course. There is no unit level data available. And until that's available, we're going to use what's reported in the fact sheets. The NFHS4 data, which are in the NFHS5 fact sheets, were used as is. We've done some cross-verification, both with the NFHS4 report and our own analysis of NFHS4, and it looks fine. And then last but not least, just from a nutrition perspective and a POSHAN Abhiyaan perspective, the indicators pertaining to the performance and uptake of the ICDS itself are not included in the NFHS fact sheets. And so that, in some sense, is going to limit the interpretation of that component of the mission's impact on coverage. But please do remember that the mission includes a range of actions, both in health and ICDS. All right, so this is the framework for the analysis of trends. So we draw on sort of this cluster of indicators that is built based on the Lancet UNICEF very well accepted conceptual framework for malnutrition, and basically it proposes that, you know, the outcomes that we're interested in are determined both by immediate determinants that relate to maternal nutrition, breastfeeding, complementary feeding, a range of underlying social determinants, and of course that, you know, a lot of what happens is affected by the interventions that feed into each of these determinant areas. What is not available in the underlying determinants is data on poverty and food security, and what is not available at all in the intervention coverage data is anything on ICDS coverage or on the reach of other social protection programs. We've also drawn two bodies of empirical work that our research team has done in the past several years. The first one is a piece of analysis we did with NFHS4, where we tried to understand what the factors were that contributed to differences between high and low stunting districts in India. And what we found there was primarily that differences in stunting between low and high burden districts, unsurprisingly, because we know that this is a multi-sectorally determined problem, is affected quite substantially by women's characteristics. So both, you know, things that reflect investment in girls, which is the attained educational levels, reflects investments in women, which is their own body mass index, and then reflects care during pregnancy, which is you know, what actually happens during pregnancy, as well as age at marriage. There's another cluster of differences between low and high stunting districts that is pertaining to assets and living conditions. And then there are some more specific things that relate to child feeding, etc. So it really is a cluster of factors, and we've really accounted for that in how we frame the analysis. A second body of work that we've drawn is a set of case studies, many of which have been published, on looking at states that successfully reduced stunting between 2006 and 2016. In this, we focus in on, so in the analysis that we did, we found that health and nutrition interventions and WASH together, so that's point number one in this, contributes to about a third of stunting improvement over time. Changes in household assets, so wealth, etc., reflecting reductions in poverty, contribute another approximately third, and then maternal characteristics contribute another approximately third. I mean, those are not exact, but you know, you get the picture. There's three buckets of things that have to change for stunting to decline. So we'll keep our eyes on that as we walk through the analysis that I'm sharing with you today. Our overall summary of findings is that on outcomes, there has been some stagnation primarily, and you know, I think some stagnation or worsening, but there is sort of strong improvement in one large state. It is a mixed picture of improvements in immediate determinants in terms of infant feeding. There's improvements in some and worsening in some others. There is some improvement in maternal nutrition in terms of BMI, but not in terms of anemia. And then on the underlying determinants, which remember I said to you contribute almost 2/3 of the change that happens over time, there is huge and consistent improvements in water and sanitation. There is consistent improvement across all states in the women's characteristics, but it is small, okay? And then on the intervention coverage, it's a mixed picture. Now on, let me just get into the results, which you know you're familiar with, but I think just seeing it in the frame would be helpful. So the trends in child mortality are that in several of the, in few of the states, sorry, you see an increase in neonatal mortality, but in most of the states, you're seeing a decline in mortality across the board. And then similar story for infant and under 5 mortality, where in fewer states you see an increase, and you know some of those increases are likely small and within confidence interval. So we need to take a look at that. Now on anthropometry, if any of you were here on the 15th, you will already see that this slide is a little bit different. What we are seeing on anthropometry is that progress has slowed. And when you look at these graphs, this is what you're going to see in every single one of them. You see the states and the union territories for which data is available on the left. You see two columns, one for which is 4 and one for which is 5. You see a change arrow, and then you see the percentage point change. We took the sampling errors from NFHS 4, which was about a little less than 1 percentage point was the anticipated sampling error. And so we've taken that into mind so that anytime you see a change that is less than 1 percentage point, we are counting that as a stagnation and not as an increase. So when you account for that on stunting, what you see is that in 8 states, the change was less than 1 percentage point. So there's a stagnation in 8 states. 10 states have seen an increase, and 4 states have seen a decrease, all right? On wasting, you see a stagnation in 4 states. In 11 states, you see an increase that is bigger than the sampling error would suppose. And then in 7 states, we see a decrease, and very similar patterns in underweight as well. Now, overweight is also a form of malnutrition, as those of you who've been following the Global Nutrition Report and other global dialogue around, and the SDGs, etc. And here is where things are a little bit worrisome as well, which is that in 16 of 22 states, there has been an increase in child overweight. Only 1 state has seen a decline in child overweight, and 5 states are basically seeing a stagnation. And the stagnation there is fine, that's great. We do not want to see an increase in child overweight, all right? I want to call out, what we're seeing here on Bihar, really promising improvements in Bihar, close to 6 percentage points. And that is a very meaningful change because of this. So the Sustainable Development Goal for stunting is around the number of stunted children in the population. It is not about just percentage or percentage point decline. And so when we take the change in stunting across the state, so we don't have population numbers for the UTs, but when we take a look at that by state, what we find is, again, this is a full stagnation story. So between 2016 and 2019, there are 44,000 fewer stunted children in 2019 if you apply the population numbers. But this really does mean that India is not going to be on track towards the SDGs, because one should have seen more of a decline in the number of stunted children by this point in time. A lot of the decline that you're seeing, which contributes to the overall average stagnation story, is coming from Bihar, which has seen a very substantial decline in the number of stunted children, reflecting sort of this combination of their large population, their high baseline prevalence, and the substantial improvement that was seen over time. All right. Now, among nutrition outcomes among adults, we've looked again here both at anthropometry and at anemia. So on anthropometry, you see a decline in underweight among women. You see a decline in underweight among men as well. Consistently in most states, you're seeing a decline. Unfortunately, that decline is coming from, it looks like, the entire curve shifting towards the right. And that's problematic because that means that in 16 of 22 states, there is an increase in overweight. And very high prevalences, of overweight. I mean, you're starting to see states where over a third of adult women are overweight, and it's the same for men. So very concerning findings here on the overweight side of the story. And then on anemia, both for children, for women and for men, you're seeing quite a consistent look of increases in different states. We haven't applied the sampling error estimations here for anemia, so once we do that, maybe some of the numbers will move a little bit in terms of how many states saw an increase and how many saw a decrease. So I just want to flag that we're in the process of doing that. But I think what's notable here is that in many of the states, you see a decline in anemia among pregnant women. And that's important, and that's positive in the sense of if you think about where anemia reduction strategies are focused right now. Trends in anemia among children children and adolescent women remain of concern. So on these, I think what we're seeing is increases in most of the states. All right. So now let's look at the determinants. So we look at infant and young child feeding as a primary underlying immediate determinant. You've already seen maternal nutrition reflected in the outcomes. Remember, that's a key immediate determinant of what happens to children. And then for the underlying determinants, we have just two to look at: water, sanitation, and maternal education and age at marriage. There is no data on poverty and food insecurity in these surveys, and so we have a separate analysis that sort of tells us, what may have happened in the last few years on that front. All right, so a mixed picture on the trends in infant and young child feeding. You see both on early initiation of breastfeeding, you're seeing a whole scale decline. So in many states, you're seeing a decrease in early initiation of breastfeeding. There is already some speculation that this could be related to the huge surge you're seeing in C-sections. Early initiation of breastfeeding is very much in the hands of healthcare providers, and so that needs some work. But the positive news is on exclusive breastfeeding. There are increases in 16 of 22 states. Some of those increases are still small, and there are some states where there is quite a decline. So I think one needs to look at that. The folks who are working on infant and young child feeding just need to look at this really carefully. And try and figure out what's happening where it has increased and what has gone well where it has what has gone well where it has increased and what has not gone well where it has decreased. Timely initiation of solid foods has gone down. I mean, this is could be related to the fact that exclusive breastfeeding itself has gone up. But again, on a positive note, and I think a finding that we have never seen actually at such a scale is the increase in adequacy of child diets. Again, those are sort of a real mix in terms of the level of change, but it is very encouraging because this has been a focused area for behavior change campaigns in the last 2 years, and it's very encouraging to see that you're seeing this uptick which we haven't seen before. Now, on the underlying determinants, a very consistent progress on the sanitation front. And very high levels of coverage have been achieved. So I think the other thing to keep in mind here is not just what is the trend, but where do you reach with that trend? And I think what we are seeing now with water and sanitation, which is households with sanitation facilities, this isn't, for example, open defecation as an indicator, but it's just the availability of facilities. But that is sort of excellent double-digit gains in most states for sanitation coverage, and it's reaching very high levels. On the maternal side, though, again, remember, close to a third of change in child stunting over time comes from these maternal characteristics. So on women's education, it's a positive trend, but it's not as large as it is on something like sanitation, and it doesn't reach the levels that you want to see this really move to 200%, right? And then on early marriage as well. It's, you see consistent declines over time, but there is still quite a lot of it going on. Now, these are both, you could say that the women's indicator is actually much harder to move. It will take a lot more effort than, the ones we're seeing on sanitation. So we should come back to that in the discussion. What happened on intervention coverage? So I'll talk about coverage of a range of key nutrition-related interventions through the continuum of care. So first on pre-pregnancy, you see strong and consistent uptick in contraception and in the use of modern contraception, and a decline in total unmet need. This is really good news. It is always good news for nutrition when family planning goes up. I think we have seen the impacts of this also on the total fertility rate across many different states. So this is something as well that we'll need to follow through in understanding some of the stunting changes, etc. And in states like Bihar, it's been a very, very high increase, a substantial increase, more than doubling in terms of the use of contraception. Health interventions during pregnancy, again, these are very important platforms for the delivery of nutrition interventions. So here what you see is that ANC checkups in the first trimester have gone up in quite a few states, actually in the majority of states. And I think what's encouraging here is that, it is reaching closer and closer towards the, the 100% coverage, not quite at 100, but you are getting further and further out to the right on these bars. On 4 antenatal care visits, it is not as positive as the early antenatal care, but there again, there is an increase in about 50% of the states. And then in several states, they are able to achieve fairly high levels of coverage for ANCs. On tetanus toxoid, I mean, this is sort of an easy component of antenatal care to move, and so you have seen an increase, not just an increase, but also achievement of higher levels of coverage in many of the states. On the nutrition component, one of the nutrition components of antenatal care in pregnancy, 18 of 22 states have seen increases in the consumption of IFA. So this is not the receipt of IFA, but anyway, what matters is consumption. In consumption for more than 100 days. And in a few states, you're seeing a decline. But I want you to sort of really, again, just focus in on the levels that are being reached are not as high as they should be. I mean, all of these interventions are intended for everybody, which means we really should be aiming for, every pregnancy being, getting full coverage on some of these interventions. These are not condition specific or context specific. All women should be getting their IFA, etc. Around delivery and postnatal, so I think here things were quite high to start with in NFHS 4 in terms of institutional births and skilled birth attendants, and so there you continue to see sort of the steady uptake, but it's soon going to reach it's sort of very close to 100%. So many for mothers here too, consistent sort of increase in most of the states. You're seeing sort of good increases over time, and there again, getting very close to sort of very high coverage. So on things like this, I think, here, if anyone is analyzing at the national level, we need to hone in on, okay, there are a few states where, you need to kind of pull up to get to 100, but in many other states, this is clearly something that's working. Now, coming to early childhood, again, as I mentioned, there's a lot on nutrition that's not available right now in the fact sheets. And so there's a whole set of interventions for which data are available in the NFHS, but they're not reported in the fact sheets. But here again, what you see is a good improvement in immunization. So 18 of 22 states saw an increase in immunization. And on full immunization, and you're seeing those bars get closer and closer, I think, to full coverage. So very encouraging. On vitamin A supplementation, which is the only other preventive nutrition intervention for which data are available in fact sheets, you're seeing an increase again in the majority of states, but there are still gaps, so there's still areas, a lot of room for improvement there. On curative interventions, here again, across several of them, there is a majority of the states, are seeing sort of an increase, and but there is a lot of room for improvement. So, for example, the use of ORS and zinc in diarrhea, there's so much room for improvement there, because you're seeing that those coverage levels, even in the best of states, is barely about just hovering around 50, whereas we want to get all of this to high coverage. And on the use of health facilities, so that's quite interesting. There's quite a lot of use of health facilities, both for diarrhea and for ARI fever symptoms. And there too, you're seeing increases in diarrhea, but with fever symptoms, you're not seeing as much of an increase, which again, infectious. All right, so in summary, on, just on these trends, what you see is that on the mortality trends, the number of states improving is much higher than the number of states worsening. On anthropometry, so on the undernutrition side, unfortunately, the number of states either stalling, so having slowed progress, or a slight or more than slight worsening are more than the states that have seen a decline. And on anemia, the number of states worsening is much higher. On adult anthropometry, underweight has declined in a majority of the states, both among women and among men. But as I mentioned earlier, it looks like it's a distributional shift, which again, we won't know the magnitude of that distributional shift until we've looked at the data, the raw data when it's available. But it looks like, because you have an improvement on the underweight side and an increase on the overweight side, so that's definitely movement there. And then on anemia, there is a worsening, but again, please note that the worsening is more for non-pregnant women, and for when you look in the female population, it's more, it's in more states for non-pregnant. IYCF practices, again, just summarizing, you see on early initiation of breastfeeding, it's 50-50. There are some states where it's been worsening, and another about 50% of states where it has improved. Exclusive breastfeeding has improved more consistently in most states. Solid foods is again sort of 50. And then I think the improvements in adequate diets are important to celebrate, but there is a huge gap there. Even with those improvements here, it has only improved to about 20%, whereas we need to get to 100 even, something like that. Very consistent improvements, as I mentioned, on all of these underlying determinants. But again, just want to point out that the extent of change and the achieved levels of change are much higher for sanitation, which again is also easier to improve in this 4-year time frame than for women's schooling and age at marriage, which are a little bit harder to move. And this is the number of states with improvements in the interventions. Again, the more states you see in green, I think the better that picture, but this is really just the number of states where you're seeing improvements. It isn't telling us about the levels of improvement. So this is a consistent picture here for coverage, right? Okay, so time we can move quickly. So I want to say a little bit about Bihar's reduction, because as you see, Bihar is contributing. The numbers in terms of the change in Bihar are what will contribute to SDG progress, because the states with large numbers of children are the ones that we really need to focus on to be able to move on the SDG indicator of the number of stunted children. So in Bihar, what you see is, there's been about a 5 percentage point decline in stunting outcomes, but that translated into just a large number of children. What happened in Bihar was this, fairly consistent, small but consistent improvements in several of the infant and young child feeding behaviors, especially I think notable changes in timely introduction of complementary foods. There's directionally, other than EIBF and EIBF, especially in timely introduction, seem to have, not gone in the right direction in many of the states. All of the others on infant feeding are in the right direction, but again, note then, you're reaching still only about less than 20% in terms of adequacy of diets. Coverage of health and nutrition interventions in Bihar has certainly also increased over time. So directionally, these are totally the right direction of change. But again, the levels achieved still need quite a bit of attention there. On underlying determinants in Bihar, really significant improvements in sanitation, but very gentle and slow improvement or non-improvement on the women's determinants. And the things like early marriage are going to take a lot more attention there. We haven't done this yet, but we certainly have been chatting with our colleagues who work in social protection and the economy, and they suggest that there's been there was a big change in the PDS in Bihar in the last few years, which has led to a big PDS offtake, and that in turn may have increased household security. As I mentioned, there's no data available in the NFHS, on that, and so we'll have to rely on other sources. Now let's come to some interpretations, and then we'll wrap up and open up. As I mentioned again earlier, please leave your messages, etc., in the chat box. Okay. It's really important we pay attention to temporality when we are trying to interpret these findings, right? So the survey was done in 2019. The children who are under 5, so the children 0 to 5 years who've been surveyed in that survey were born between 2014 and 2019. Those of us in the nutrition community, we know that there was a lot of movement and a lot of interest, a strong recognition that nutrition was an important policy agenda. However, the policy evolution and the emergence of sort of the big targeted visible nutrition mission happened over a 4-year period. So both the nutrition mission, POSHAN Abhiyaan, and Anemia Mukt Bharat, which are of course tightly connected, they were launched in 2018. The things that we see quite a bit of change on in terms of financial inclusion, immunization, sanitation, those were missions that were established in 2014. The other thing that is important to reckon with in the context of interpreting stunting findings in particular is that India's economy was affected in very different ways, and there were some substantial shocks on the economy during this period. And we must consider those economic shocks and the implications of that for poverty, for food insecurity, etc. There is no publicly available data to go directly to that, but the data that we do have available, and this is compiled by my economist colleagues, indicate that there were a range of different economic challenges that we need to contend with. So firstly, if you look at the slide on the top right, the leftmost bar is the unemployment in 2011 with 11-12. All of the right-hand bars are the levels of unemployment. This is rural unemployment in the 2016, 17, 18, 19 period. And so what you see is that those are very high levels of rural unemployment. The second piece is that there has been a stagnation in expenditures. Expenditures are what we use to look at the state of people's lives, and they will tend to go up usually, but there's been it's been fairly unstable, and in 6 of the 12 states for which we have data available here, they reported lower consumption expenditure in 2019 compared to 2017. And then some data, which is on the left side here, compiled by Accountability Initiative, also says that there was substantial food inflation over this period. So you put these 3-4 things together, and the picture that becomes quite clear is that there were likely some substantial economic challenges there, which have contributed to perhaps the stagnation in stunting changes. The other indicator of economic challenges is that Manrega had much higher demand than available funds in the 2014 to 2019 period. So across this period, if you look at it, that red bar there is the households that wanted employment under Manrega, but the gray bar is the proportion who actually received it. So there was a gap there. And then, there is also fairly documented bodies of work suggesting that there were a range of issues around delays in payments and, other pending liabilities, et cetera, around the program. Now, there has been a huge new allocation to Manrega this year, so I think it'll be interesting to see, whether that changes some of the picture. So I'm going to just come back in a final interpretation, just come back to this thing, say, look, what are we trying to do here? We're not trying to recuperate individual children's growth trajectories. We're trying to get population level change in something like stunting. So what does it take to reduce population level change in stunting, and how does what we have seen so far compare with that? So we, as I mentioned earlier, focusing in on the yellow box, the kinds of things that we have empirically documented to lead to stunting change at a population level are, health and nutrition interventions plus WASH, maternal characteristics, and household assets. What we want to see now is how did the change that we have seen stack up against what we know leads to population level change? So the overall picture that I'm left with is saying that the changes we saw, and you have seen that there are changes across all of those many different drivers. These were all necessary changes, but they were likely not sufficient changes. So on the first one-third, on coverage and immediate determinants, as you've seen, it's a mixed picture on coverage, but a generally positive trend. We don't know anything about, either ICDS program coverage or really the reach of social protection programs. But in some of the determinants there, again, it's a bit of a mixed picture, but, it's not bad. On maternal characteristics, again here, what we've seen is that the levels remain high on many of these determinants. So, this is a short period of time. This is a big bucket of drivers for any malnutrition, undernutrition outcomes. It is not going to be, we think this is an area where change anyway typically happens slowly, but if there hasn't been sort of big concerted policy around these, you're not likely to see a super quick change. On the household condition side, there have been changes in at least one dimension of conditions, which is huge and consistent improvements in water and sanitation. We know very little about the actual changes in poverty, food insecurity, or inequalities over this period because of data gaps. However, what we've compiled in terms of the economic story over this period of time suggests that there were several, both economic shocks and slowdowns. The unemployment numbers are a very important part of that picture, but also that the major social protection programs such as Manrega, which is a rural poverty focused program, was affected by administrative changes and issues that may have prevented it from being a full functioning social safety net. So this is my last slide. Again, this is an update for those of you who may have seen this on the 15th, because we've been thinking a lot about this. So what do these early interpretations mean? And really, I'm only talking about the stunting reduction story here. I think there's a lot to unpack on anemia, and there's a lot to unpack on the overweight side. So on the interventions and behaviors part of it, which contributes to about 20 to 25% of change in population level changes that we've seen in the successful states, I think our, sort of the key takeaway here is that, we have to stay the course because there are gaps to be filled and in coverage and in behaviors. And so, really staying the course, but intensifying efforts to keep the focus on reaching every woman, every child with that full set of interventions as outlined in the mission and as available in the programs is going to be really important. Actually using data to focus on the areas where the gaps are most prominent is also going to be really important. Now on behaviors and diets, I think very promising to start to see the movement on complementary feeding. But I think we need to understand that also in this time period, we've seen a lot of research that tells us that household resources, time and workload are very important constraints to achieving healthy diets. There's a range of research emerging on the cost of diets, etc. And so if we really want to improve diets, I think we have to link with household economic support. Now, the underlying factors, which do contribute to about 2/3 of change in success cases and are known to be strong drivers of malnutrition, we know a lot about how dramatic the change has been on sanitation, how modest it has been on the maternal characteristics, and how it is likely that there have been substantial challenges on the economic, on the asset side of things, but we don't have the full data on that. But I think knowing what we know, we need to really think about bringing in these other sectors, both education and social protection as vital sectors to include in the nutrition mission. And I'm going to say that the social protection side of things needs to be prioritized because it's something where we have the policy instruments in place and can move much faster. And right now, the nutrition strategy is not yet coupled with the poverty food security strategy. They're moving in parallel, but they're not coming, by design, they're not coming together. They may be coming together by default in many geographic locations, but accelerating the targeting and co-location of the existing social safety net programs to, what we know to be vulnerable 1,000-day families can be a very important starting point. It makes sense from a design perspective. It makes even more sense when we see what is available data. So I'm going to stop there, and apologies for going a little bit over time, but I'll stop the share and then open up for